Welcome to St Margaret's Hospice Care. My name's Anne Lee and I'm the Chief Executive here. I'd like to extend a huge warm welcome to you for joining St Margaret's family. I've been at St Margaret's since 2000. I first started as a Director of Nursing and in 2015 I became the Chief Executive. It is the most fabulous organisation to work for and I hope that you really enjoy your stay here with us. This is an opportunity, whether you're volunteering or a staff member, to really build a relationship with the charity and enhance your career or fulfil some of your lifelong ambitions. We serve a population of 500,000 people and we have 5 teams working out in the community. Most of the work that we undertake is out in people's homes or their normal places of residence. We're about making sure that we fill the gap that sometimes the NHS can't provide. That's really our charitable function. We're not just about cancer. We also look after people with many complex needs. And as our population is ageing, so the complexity of the conditions that they face have increased. And that's why we are open to anyone with specialist palliative care needs and we provide those services. The care that we give is really personalised. We give it when people need it and wherever they need it. It's usually in their usual place of residence, but we can find our work extending out into the community hospitals where sometimes people find themselves, or also in nursing homes. Our teams also work collaboratively with consultants in palliative medicine who work in the community. Working collaboratively is a very important part of what we do. We work with families, we work with friends, and we work with other healthcare agencies to try to make sure that the care that people receive in Somerset is personalised. We work with the whole family, and we have a family support team, and we provide one-to-one counselling sessions too. This year is our 40th anniversary, and we're really excited about that. For a charity to have survived for 40 years, it marks something that's very, very special. And under normal circumstances, we would have had lots of events to celebrate that all the way through the summer. But of course, COVID-19 has had an impact on the way that we're able to celebrate and hold events. But whether you're working in shops or as a volunteer, there are lots of things that you can still get engaged in. There is lots of activity going on in a virtual capacity. And where possible, we are holding smaller events to celebrate those special times. Your role, whether you're a staff member or a volunteer, is a very important one. We're all ambassadors of St Margaret's. So whatever you do, wherever you're working, what you actually translate and communicate to the community is very, very, very important. You're all making a massive difference to the care and support that we can provide across Somerset. I hope that you enjoy your time here just as much as I've done, and that you really make every day count for your careers and fulfilling all the things that you want to do as you work with the charity. I wish you every success and happiness, as this is a very, very special place to work. Thank you.
So I'm really happy to be here today. I think this is a privilege to welcome new volunteers to the hospice, and we all want you to have the best possible start volunteering for us. So this induction is really to tell you about the work of the hospice and what you will be doing to support it. This is a facilitated session, so we're not experts, we're just leading you through material that we have. So this is the link that our hospice has with the community currently. So only less than 50% of our community is actually familiar with the hospice. Just 50% have been into a shop. We are very much known for our work in terms of the shops, because they are very much a sort of public-facing image. They're in people's towns and villages, and often the sort of the touch that people will have with St Margaret's. And going back to what Anne said there, 1 in 3 people in Somerset will need support from St Margaret's. I always find these statistics amazing. It's quite humbling. We've still got a lot of work to do to let people know what's available and how we support people. So, this is Dame Cicely Saunders, and she started the hospice movement in 1967 with a hospice in the London area, St Christopher's, and she is very much the founder of the modern hospice. That's the building there. There is more information sort of online if you want to find out more about how that all came about. I'm just going to let you read through this one. This is a sort of statement from Hospice UK, which is the sort of umbrella body that all hospices in the UK belong to. So it really it talks about not just the care that is to be provided for patients, but also for friends and families as well. And then alongside that, not just the very medical style care, but all that supportive care which goes alongside it, which is so important. We are part of a global movement, so apart from the UK, Canada and America are also very sort of world leaders, if you like, in hospice care. Other countries as well want to learn from us, so we've done a sort of staff swap, if you like, with staff from both Portugal, Cyprus, and India. Where staff from sort of hospices or similar type style units have come across here, and we've sent nurses across and sort of shared learning and best practice, which is fabulous. Myths about hospice care. Are you familiar with any sort of myths about what people think about hospices traditionally? I think that's quite common actually, that once people have actually stepped inside the building and actually worked out that it's not weeping and wailing and a sort of, very doom and gloom.
Atmosphere.
Yeah,
Exactly.
people laugh and, it's such a lovely atmosphere. So some of the other sort of common misconceptions about hospices are that they are just about dying. So actually around 1 in 3 people will actually sort of come into the hospice unit and then actually go home after having their medications readjusted. Also, we're not just about cancer, so that's another common misconception. People think it's just cancer patients that we look after. It's other life-limiting illnesses as well. Such as heart failure, lung diseases, muscle wasting diseases, and more. But yes, so it's not just cancer, and that's quite a common sort of misconception, even amongst healthcare professionals actually, yeah. And also another one is that people think it's just about the wards, so it's just about the inpatient unit, when actually the majority of our support is given either through outpatient sort of clinics or by our community teams, whether nursing or sort of supportive care. So again, people don't see that unless they experience it. I suppose they have no reason to. So we're always trying to sort of break down those sort of myths and get the sort of message across. So here's some of our numbers. I'll sort of let you have a little read of those. So I think that really shows that it's not, just inpatient services, and that, carers are becoming, more and more part of the picture. So yeah, we do have a 24-hour advice line, which means that people can call up in, you know, the wee hours of the night when things are always 10 times worse because there's nobody to call, and you know, there is always somebody that is at the end of that phone and they can speak to, which is, yeah, fabulous service. So here's a bit more about all the different services. We've already spoken about some of them, the advice line and the lymphedema, and family support. So we have day hospice here, which runs in Taunton and Yeovil on Monday, Tuesdays and Wednesdays. And patients get transport in and then spend the day with us and have lunch and do crafts and art and all sorts of
quizzes,
yeah, lots of you know, nice things to break up the isolation.
Nice days they can go out in the garden, and you know, they get, you know, either in the wheelchair or they can walk out in the garden and that.
Yeah, which is, you know, beautiful garden. And then also, you know, there's clinical staff here, so, you know, they can get that sort of input as well, if needed. Physiotherapy, social work. We have a sort of big education and learning team, which not only we provide training, obviously, for our staff and volunteers, we also provide sort of workshops for patients and carers. And we also link with nursing homes and other healthcare professionals in the area, sort of upskilling them around sort of palliative care so that it enables them to do their sort of work better. We have our psychological therapies, spiritual care, bereavement counselling service, again, which is fabulous. St Margaret's has been going since about 1980, so celebrating 40 years this year. We serve a population of just over 500,000 people and 70 GP practices. There are about 5,500 people who die in Somerset every year, and an estimated 4,000 of those would benefit from hospice input of some sort. 3,000 patients actually access St Margaret's, so we've still got some work to do. We are the provider of specialist palliative care in a number of settings, all of which are enhanced by volunteers. We do have the specialist inpatient units with specialist doctors and consultants and nurses. We also have links into community hospitals across the county, and we have 5 community nursing teams who go out and delivering a lot of our services sort of out in people's homes, which can be really invaluable, especially given sort of isolation and sort of ruralness of the county. And that Echo Hub one there, that's the nursing home project, so that's the sort of official title for it. But it's a national sort of project, and we've been chosen in Somerset as the sort of providers of it. So how do we support all this work? Well, fundraising, that's obviously a big part of what we need to do to get the money to provide this support, as well as our shops and other retail ventures. And then, you know, all of our communication and marketing teams, so you might have heard some of the radio adverts we have out at the minute. And then the sort of, you know, the real sort of nitty-gritty, the human resources, IT, everything that, you know, needs to happen to make everything run smoothly. So if you're volunteering with any of these areas, you know, do be reassured that it is absolutely important to the work that we provide to patients and carers. So who are we? We are 400 staff approximately and 1,200 volunteers. We would literally not be able to provide what we are providing without your help. Every bag of donated clothes could raise £25. And below that is a little pie chart of where our money comes from. So the light blue one there, the 38% is legacies. The NHS provides roughly 34%. And then the other smaller blobs are fundraising, others, and commercial. So the hospice isn't part of the NHS, but they do provide some funding. So we had the honour of being given the Charity Today Hospice of the Year Award in 2018, and our hospices are rated outstanding by the CQC, which is quite an honour indeed to get the highest recommendation. So we are absolutely thrilled about that. So these are our values as an organisation. These values straddle across the organisation. I mean, I absolutely love St Margaret's. I've been here for 13 years or thereabouts, and it's just a really special place. I mean, nobody wants to be here, but if you have to be supported by anyone, then St Margaret's is, the people to do it.